Good morning, everyone. It's great to see you today. Welcome. My name is Renee Bird-Lewis. I'm the CEO of the Gwinnett Coalition, a Gwinnett County community development organization. We bring subject matter experts and organizations together to achieve social change, and our vision is to ensure that all residents have the opportunity to thrive. Today, we are hosting our 7th Healthcare Summit in collaboration with the Gwinnett Newton Rockdale Health Department. Today's program will be offered in both English and Spanish via live interpretation. And I'd like to take a moment to introduce Luigina Johnson and Claudia Mendez Parker, who will serve as our interpreters today. They come to us from Westbridge Solutions. And at this time, this is very important. I need for everyone to kind of perk your ears. We need everyone to select your language preference for listening. At the bottom of your screen, you should see a globe. Click on that and simply select English or Spanish. And then also, please choose the speaker view at the top right of your screen. Now I'd like to pause and let that be translated into Spanish by Julio Carrillo.
Buenos días. Me gustaría tomar un momento para introducir a Luigina Johnson y Claudia Mendez Parker, quien servirá como su intérprete el día de hoy. Ellos son parte de Westbridge Soluciones y en este momento necesitamos que todos seleccionen el lenguaje de preferencia para poder escuchar esta presentación. En la parte derecha de abajo encontrará una bolita que parece como el mundo. Por favor, dele un clic y seleccione español y para que pueda tener acceso a un intérprete en español.
Thank you, Julio. All right, now that everybody has selected their preference, either English or Spanish, we are operating on a virtual platform, but we want to engage you in this conversation and in the information that is being presented. If at any point you have a question, please enter it into the chat box. Alana Solka, Chief Clinical Officer for the Gwinnett Newton Rockdale Health Departments, will work to answer your questions along the way. And we may hold some of those questions to the end of the program to have one of our panelists answer those questions in the QA session. But engage with us, ask the questions, and Alana is there for you. Now, it is my pleasure to introduce Dr. Audrey Arona. Dr. Arona graduated from the University of California, San Diego, with a degree in cell biology, biochemistry, and thereafter graduated from the University of Cincinnati College of Medicine in 1991. She completed an OBGYN residency at USC in Los Angeles, and in 1995, she began private practice in San Jose, California. She later moved to Lawrenceville, definitely our gain, and where she owned an OBGYN private practice for 20 years. She served as a consultant to the Gwinnett Newton Rockdale Health Department in 2012, and in 2018, she became its medical director. She is now the CEO of the District Health Department. So with that, it's my pleasure to turn the program over to Dr. Audrey Arona, our favorite in this community. Thanks, Dr. Arona.
Thank you so much, Renee, for that warm welcome, and good morning to all of you. I am going to try to slow down so that all this can be interpreted. I think it's our tendency to rush through data and rush through our presentations quickly because there's so much to share with all of you. But I'm really going to try to slow that down a little bit. I am going to share my screen, if you will, just for one moment. And Renee, if you can make sure that give me a thumbs up that you can see it. Okay, wonderful. All right, so these are cumulative data, and it's really important that we all kind of take a moment just to look at these numbers, because at this particular time, you know, what are we, 18, 19 months into this pandemic? Worldwide, we have over 250 million cases, and we've had over 5 million deaths worldwide for a pandemic that's been here for 18 months. I mean, that's astronomical numbers. And again, these are cumulative since the pandemic began. In United States, we've had over 46 million cases and over 750,000 deaths in the United States. And I emphasize that just because we still hear from people who don't believe that COVID really is a problem. And if you look at that number, that's an astounding number. And so it's just evidence that this pandemic has really hit all of us hard.
Room? Can you hear them? Are you able to record?
In Georgia, we can hear whoever that was. In Georgia, we've had over 1.6 million cases and now over 25,000 deaths in Georgia. And Gwinnett County, we've had over 134 cases and 1,390 deaths. And these are as of yesterday's data. But, you know, those are cumulative numbers. So to look at where we are currently in our community as to what transmission levels of COVID we currently have. So let me present some data from Georgia and Gwinnett County. So Georgia's 14-day published case rate. So this updates every Monday. Whatever data that you use just has to be a consistent model that you look at the data from time to time. You can't look at the 14-day published case rate and then look at the 7-day rolling case rate and do comparatively, because none of that will make sense. So what we do here is follow the 14-day published case rate. And for this week, it updates every Monday. For Georgia, it's now 150 cases per 100,000 population. And again, this is still in high transmission because over 100 cases per 100,000 is considered high transmission. But for relativity purposes, our peak in September was 1,212. So that's not even 2 months ago. And you can see how, you know, this is good news that our case rates are declining, but nonetheless, we're still in high transmission. So we also look at the 14-day published PCR, percent positivity. PCR is a standard test for COVID, and the case rates that I gave you up there include the antigen cases as well as the PCRs. But for the percent positivity, we use the PCR test only, and that is 3.3%, and that's updated every Friday. And below 5 is minimal, which is great, but our peak in September was 17.4. So you can see again another indicator that our situation with COVID is improving for sure. So lastly, we look at case rates for our school age kids, because of course we're in the middle of school and there's all this controversy about mask mandates and how the schools are helping to protect your children in our community. And so right now, for Georgia, our case rate for 5 to 17-year-olds is 173, again, still high, but look at that peak not even 2 months ago, 1,860. That's a phenomenal change and good thing, but nonetheless, we're still in high category. For Gwinnett County, our 14-day published rate is 132 now, so we're close to getting out of that high transmission category. And in December, it was 601. So again, much lower now. And our 14-day published percent positivity for PCR is now 3.9%, and it was 13 not even 2 months ago. So currently our case rates for school-age children 5 to 17 is 145. So that's great. Look at that peak not even 2 months ago, 833. So again, we are still in high transmission based on the case rates being over 100, but low transmission due to the positivity. So our indicators are getting better. So a lot of this improvement has been, of course, with our vaccination efforts. And you should know, comparatively speaking, now I'm talking about the overall population. So this includes now the recent 5 to 11 years that are eligible, which we'll talk about. But in the United States, overall population, including those under 5 years old, fully vaccinated, we have 58% in the United States. At least one dose of the vaccine has received 68%. So again, pretty low numbers, but comparatively, Georgia is at 50%. Fully vaccinated, 57%. We've given over 11.5 million doses in Georgia. And look at this, 432 million over those numbers of doses in the United States. So, you know, again, it's telling to those who argue that the vaccine, they need to see more people who have received it to understand, you know, the side effects and all. That number is astounding. 432 million doses of this vaccine in the United States has been given. So for our county, over 1 million doses have been given, and 60% of our overall population has received at least one dose, and fully vaccinated 54%. So again, these numbers increase slowly just because it's one of the reasons we're having this summit is to really try to encourage people, you know, to get vaccinated and why. So looking forward to what Dr. Salinas has to say to us too. So Dr. Drenzik is going to show this a little bit different way later, but I wanted you all to know the age numbers for Georgia. And, you know, the good news is that most of our elderly population, as you can see, are really pretty much protected. I mean, a lot of people over the age of 55, 60 are vaccinated. And, you know, this is really where we wanted to be a year ago, you know, when we didn't even have the vaccine. It's coming up on a year very shortly. Remember, we were all about protecting those most vulnerable, and that was primarily our elderly population and those that immunocompromised and others at risk. But isn't this interesting? Because that's the population we were most worried about. However, now to end this pandemic, we really need to see the 5-year-olds to the 50-year-olds, you know, step up to get vaccinated so that we can put our masks away for good. But again, we need the younger population now to get vaccinated to end the pandemic. We've done a pretty good job of protecting our elderly, but we need everyone else that's younger now to really help us end this pandemic. So Gwinnett County is very similar. Our numbers, we're doing a little bit better than overall, just we're a metro county. And so I think that helps. But with the younger people, we still need obviously a lot more. So looking at race and ethnicity for Georgia, the numbers of people, you know, we have about 47% of African Americans that are received at least one dose and 48% of Hispanics. And so again, you know, that's been, you know, our major focus here. We really are working hard to change these numbers. And to give you, you know, Gwinnett's perspective, we're very similar to that, a little bit lower in the Hispanic. So we're 46.5% African American with, can you all see that, with 39% Hispanic. All right, so as far as the vaccines right now, this is what we have available. Vaccines are under emergency use authorization for 5 years and older. Pfizer is fully approved, not under an emergency use authorization for the 18 and older first and second dose though. The third dose boosters and of course the pediatric dose are still under emergency use authorization. But I want to just kind of show you what vaccines are available in the United States. And so we have Pfizer, first, second, third dose is for immunocompromised, and boosters are for 6 months. People have been fully vaccinated for 6 months or more. And all of these doses, first, second, third, and booster are all the same dose of Pfizer. Pediatric dose, which was recently approved, and we're working on disseminating that right now. The pediatric dose is a smaller dose, but nonetheless. Mrna is only approved or under emergency use authorization for 18 years and older. First, second, and third doses are all the same. The third dose is for immunocompromised, similar to Pfizer, but the booster is a half a dose for Mrna. And that, again, just similar to Pfizer, has to be 6 months or more from full vaccination. And now the Johnson & Johnson has also been approved for a booster. Again, it's under emergency use authorization for 18 years and older. And the first dose and booster doses are the same dose, but the booster is allowed 2 months after the first dose of Johnson & Johnson that's been received. So let me stop sharing my screen for a moment. And I just wanted to pause and just say again, you know, I will be back with you later in the program. But at this time, I wanted to move on and introduce to you Dr. Daniel Salinas. So we're so welcome. We're so excited to have you here with us today. And I'm proud to introduce him to you. Let me tell you all a little bit about Dr. Salinas. He is the Chief Community Clinical Integration Officer for CHOA, Children's Healthcare of Atlanta. And he really establishes relationships with community pediatricians and inspires them to work collaboratively with CHOA. He helped to develop the Children's Care Network, which is one of the first pediatric clinical integrated networks in the country, which he oversees that program, which is amazing. He's a very well-known pediatrician and physician leader that's committed to the care of Georgia's children. We're so grateful for you, Dr. Salinas. And before coming to Children's, he served as regional vice president and national medical director for WellPoint. And prior to that, he was vice president and medical director for Blue Cross Blue Shield of Georgia, and served in a number of leadership roles at Kaiser Permanente in Georgia, where he also practiced as a pediatrician. So he's a native of Houston, Texas. He earned his medical degree at the University of Texas Medical School after earning his bachelor's degree from Texas Lutheran College. And he and his wife live in Roswell, and they have 2 adult sons. And we are so pleased to welcome you. Good morning, Dr. Salinas.
Good morning, Dr. Arona. Thank you all for having me. I will say to you all how really proud I am that you have developed this coalition, Gwinnett Cares, especially during the time of this pandemic when there's so much of an opportunity for us to share factual information, fact-based information, in this case about COVID, but I think you have a model here for how to deal with healthcare issues for a long time to come as they arise, because we'll continue to have issues that will arise. And the coronavirus pandemic, it's going to be with us for a while. I think we will get and have gotten better and better at dealing with this. And as Dr. Arona mentioned, one of our tickets to really dealing with this is vaccination, now all the way down to age 5. And hopefully at the beginning of next year, and the studies are underway, children down to the age of 6 months will be able to get vaccinated. So that's one of the ways. The other ways is the development of therapeutics, which you've seen recently. Pfizer and Merck have released a capsule that actually is given at the first sign of SARS-CoV-2 infection or COVID infection. And hopefully between a combination of vaccination, continued diligence around mask wearing when appropriate, watching our distance when appropriate, staying home when we become sick, and that will continue to help us to fight this virus. And I hope that in the future that COVID-19 will become a mere nuisance to us and not so much of an issue as it is today. So I appreciate the opportunity to talk with you. And Dr. Arona, thank you for that introduction. And for those of you who don't know, Georgia Department of Public Health they have been some of the biggest heroes in our COVID-19 fight. And there's one website that I use almost every day, and it's the Georgia DPH COVID website. In fact, I'm going to show you a graph in just a minute from that site that really tells the story about COVID-19 in kids. So what I wanted to share with you is a little bit of that COVID-19 and kids story. I'm not going to use slides. I'm going to just talk through some points. And then I want to spend some time talking about the COVID-19 vaccine, especially as it relates to kids, and especially as it relates to some of the myths that have been propagated in the community. Someone told me yesterday that they never knew that there would be 325 million experts on COVID-19. That is the population of the United States. So we have a lot of experts. So what we have to do, and of course, Facebook is one of the biggest expert sites, and I'm saying that tongue in cheek, but what we've got to do is stay educated. And what y'all are doing through this coalition is just that, which is really, really remarkable. So I'll never forget that day in March. It was a Friday, around March 11th, 12th, something like that, I believe, when we got our first COVID positive patient at Children's Healthcare of Atlanta. I'll never forget that day. We were all called, all the clinical leaders were called into a meeting to talk about this one child. She was about an 11 or 12-year-old. She got really sick, had to have ICU care. And I'm not divulging anything out of HIPAA because that family at the time went public with their story. But that was our first case. And since then, as they say, the rest is history. In the early stages of the pandemic, younger children were not as affected by COVID. They were not little cesspools of COVID. we came to find. As the pandemic progressed, and I am going to share a slide, and it is from my favorite website. Let's see here. Should be it. Should come up. Let's see. Looks like I've got to allow my system to share. Can you see this? Are you able to see? No, not yet. Hold on. Let me allow this sharing. One moment. I apologize. The screen is up, but looks like I've got to put in my password to allow myself to share this. So I think it'll work now. So this is saying I may have to quit and then reopen. Oh, well, no, let's do that later. Okay, I'm pretty techie, you guys, but today my technical skills are not cooperating, but I'm going to see. I think I can now share it. Okay, here we go. You able to see this? You can. Okay, great. So I wanted to show you how this pandemic has worked in kids. So this is from the Georgia Department of Public Health site. And in fact, a lot of the numbers that Dr. Arona shared today, if I wave over these different parts of the graph, you can see some of those statistics that she shared. So this is the 7-day moving average of COVID cases in children from the beginning of the pandemic until now. And there's a couple of things I want to point out. The first is that, so we're in our 4th wave of the pandemic. So the purple line is the 10 to 17-year-old line. And you will see that starting in July of 2020, January of this year, and then of course, July of this year, that the 10 to 17-year-old age group, and this is primarily driven by the 13 to 17s, they have always had a higher rate of COVID compared to the other children. But what I wanted to show you though, is the difference in the 5 to 9-year age group and the difference in the 1 to 4-year age group, and even in the infancy. In this last wave of COVID that we are now hopefully finished with, you can see the incredible spike of cases. We think this is related to the transmissibility and infectivity of the Delta variant that you've heard of, but you can see the peak in the number of 10 to 17, 5 to 9, 1 to 4, and even infant cases. And we experienced this at Children's with the number of cases that we saw. But I thought that you would find this interesting just to see the stark differences in the age group of affected children. So it was very appropriate that on Wednesday of last week, trying to get back to my regular screen, excuse me. The day that the Braves won the World Series is also the day that the Pfizer vaccine became available for children, and it was extremely well received. We began providing vaccinations to kids that on Wednesday. The World Series was won on Tuesday, vaccine was approved, and we began to provide the vaccine to kids on that Wednesday. For those of you all from Gwinnett, we have a vaccination clinic for the 5 to 11-year-olds at our Satellite Boulevard location, and it's manned by a vendor that's called COVID Cares. So with that as a backdrop, the one graph I don't have that I wish I had to show you is the number of cases of MISC, multisystem inflammatory syndrome in children. And this was a complication of COVID that was discovered after the 2nd wave, It was first described in England, quickly was then discovered in the United States when a group of cardiologists band together, including a cardiologist from Children's that was part of this national group, to create this definition for this disease called MIS-C that affected kids after COVID. So it's fascinating. If you superimpose the MIS-C curve onto the COVID pandemic wave in children, you'll see that 4 to 6 weeks after each of the waves, we began to see and saw a significant spike in cases of multisystem inflammatory syndrome in children. And this is a self-limited condition. It's a massive inflammatory condition that affects the heart significantly. About 50% of the children with MIS-C ended up in the ICU for a few days. This looked like a disease called Kawasaki, which you may have heard of. That's an inflammatory disease that affects younger children. This particular COVID complication affected older children, above age 5, and even into the teens and beyond. And the unfortunate part of this disease is that there was a predilection to affect African American and Latino Hispanic children in higher percentages. We still don't understand why that occurred, but that was one of the demographics those two demographics that were primarily affected. So in summary, 4 waves of COVID in kids. The last wave affected kids much worse. We think it was due to Delta. The second, third, and fourth waves have all had this condition MIS-C associated with it. The kids that get that do well in general, but it's a severe complication. And in some of the kids that get MIS-C, they were not even known to have had a case of COVID, incidentally. They're positive incidentally, or they're positive by antibodies where we're able to demonstrate that they had COVID, but they present with fevers and inflammation and swollen lips and red eyes and swollen tongue. It looks just like Kawasaki disease, but it's a serious complication. I only say this because there may be some people that say, well, why does my 5-year-old have to be vaccinated? And because COVID may not affect children that significantly. I will tell you that the Delta variant has affected children more significantly. And the complication of MIS-C has occurred in kids that were not even known to have had COVID. So if families, there are a lot of reasons for families to choose to vaccinate their children, not the least of which it prevents the spread of COVID in general, but it also can prevent the development of MIS-C. So a couple of other things that I want to share with you. We've had about a total of 500 deaths that the CDC has reported in children with COVID-19 throughout the United States. So it's not insignificant. As of yesterday, we had 14 children hospitalized at Children's Healthcare of Atlanta with COVID-19. About 2% of our 2.5% of our total hospitalizations for the day. As usual, though, the majority of the children that are in the hospital with COVID right now have some type of additional medical condition, so some type of comorbidity like diabetes or asthma or cancer or some genetic conditions. Some of the children also have significant obesity by definition in a child. So like in the adults, a lot of the children that get hospitalized end up having a comorbidity, and of significance, similar to the adult population. Out of those 14 that were hospitalized, only 3 had had a COVID vaccine. So you can see there's a pattern, and Dr. Arona will confirm with me that a lot of this very pattern in adults, the adults have not been vaccinated either, especially during this last hospitalization. Some other things that I wanted to share with you about the COVID-19 vaccination, just in general, because these are some of the concerns and some of the myths that you'll hear expressed in the community. One of them is, well, I've had COVID-19, so I don't need to get vaccinated. the truth of this is that there really is no long-term data that shows that having had COVID-19 confers a long-lasting immunity to the disease. So the fact is that if you've had COVID-19, you still have to get vaccinated because you're still 2 times as likely to have COVID again if you have COVID and are not vaccinated. So I think that's important. The other thing to remember is that the variants that occur because the virus infects someone, and it is during that infection that the virus, to protect itself, creates ways to mutate itself so that it is the one way to prevent the mutation is for us to get vaccinated so that the virus doesn't have an opportunity to fully manifest its disease in our body. So if we have more people vaccinated, there's less of a chance that the virus, the COVID-19 virus, will continue to mutate, and that variants will therefore not have a chance to develop. There will always be variants in viruses. Dr. Arona will attest that the flu virus drifts or mutates every year or every couple of years. The flu vaccine is not as effective as the COVID-19 vaccine in fully preventing influenza. So we have a chance here with this very well researched vaccine to really help prevent COVID-19 spread and evolution of the disease. So as more and more people get vaccinated, the virus will infect fewer people, and there'll be less of a chance for transmission and less of a chance for that virus to mutate. The other big myth about COVID is that about the COVID-19 vaccine is that it affects fertility. And so a lot of families, a lot of young women, 20 to 35 that are within that childbearing age to receive the vaccine. We know that it appears that this vaccine does not affect fertility, and that there's no reason for families to fear that if they give their child this vaccine, a female child, that there will be a chance for it to affect fertility in the future. So the American College of Obstetrics and Gynecology came out with a big statement a few months ago that this vaccine was safe, not only in childbearing age women, but also in women that are pregnant. And in fact, it appears that if a pregnant woman is vaccinated, that the antibodies that she produces can be passed to the baby to protect them when they are born for a particular period of time. One other myth is that if you get the COVID-19 vaccine, that it will change your DNA, it will change your genetic makeup. And that is actually not true. The messenger RNA vaccine, so the Pfizer and the Mrna vaccine, it injects a COVID particle factory into your muscle cell, into the cytoplasm of the cell, where the genetic material does not exist. So in and of itself, that RNA is able to go into our cells and start to produce an antibody against the spike protein. And that's the way that we're protected against COVID by this particular vaccine. So it does not change our genetic makeup. And in fact, we are not injected. Another myth is that we're injected with some type of tracker when we get this COVID-19 vaccine. And people are afraid of tracker. And I want to show you the one tracker that we have in our pockets or our purses at all times to this day. We already have a tracker, but this vaccine is not a tracker. The vaccines are free and readily available. If you Google CHOA, COVID vaccine, you'll find vaccine sites for kids spread throughout metropolitan Atlanta. If you also go to Georgia, if you Google Georgia, COVID DPH, you'll also find vaccine availability, including at some of the doctor's offices. And we are promoting through our through Children's the ability for pediatricians and family doctors. We've created a COVID vaccine toolkit to be able to provide the COVID-19 vaccine in their offices, and many of them are doing it, including now in the 5 to 11 age group, where the vaccine has been made. It's a much smaller dose. It's about 1/3 of the adult dose at 10 micrograms. So it's a smaller dose. It's easier for the pediatricians to obtain. The amount of dose that they receive is smaller, so they're able to give it in smaller numbers so that it's not wasted. And the storage requirements for this vaccine are very different than they were originally, where you saw those in the media. You saw those deep freeze vaccine freezers that were required. Now we can keep this vaccine in a regular freezer. It can be put in the refrigerator. It lasts for a period of time. We know so much more about the vaccine than we did before. A couple of other things. So I want to leave some time for questions. If a child is close to age 12, they should get whatever vaccine for their age group. If they're a few days away from their 12-year-old birthday, it's okay to wait till their 12-year-old birthday. But the point of this is, if they're 11, let them get the 5 to 11 dose. They don't need to wait for the 12-year-old dose. We will know more about boosters in children later. Those studies are being done now. It's also safe for kids to get the flu vaccine and adults, the flu vaccine and the COVID vaccine at the same time. And so please do everything that you can to promote influenza vaccination at the same time that we are promoting COVID-19 vaccination. Side effects from the vaccine in kids are rare. The most side effects, just like in adults, and it's even less severe in kids, it's a sore arm and some mild fatigue. So overall, this is a safe vaccine. We are so fortunate to now have this vaccine available in children. I highly recommend it. We had talked before about the 3 W's during the pandemic, which was wear a mask, wash your hands, and watch your distance. And I want to add a 4th W, and it's, will you please get your COVID and your flu vaccine? And Dr. Arona, I figured you would appreciate that 4th W, because I know that we all work hard, and our public health colleagues work very hard to promote vaccination. So I'd like to open up, if I have a few minutes, Mrna, to answer some questions.
Absolutely.
And I talked fast, I apologize. I wanted to cover quite a bit of that information, but I hope that I've given you a picture of COVID in kids. It's been, in many ways, it's been the same, but in many ways, it's been different. And one of the biggest ways it's been different is the development of MISC.
Alana, are there any questions that have come through the chat that might be shared?
I have some questions.
Oh, Paige, go. Sure.
Good morning. Dr. Salinas, can you tell us a little bit about the difference between the dosage for the child's vaccine versus the adult?
Yes, so the only vaccine available for children 5 to 11, 12 to 18 is the Pfizer vaccine. And the dose of Pfizer vaccine is 100 micrograms for 12 years and above. The dose in the 5 to 11 is 30 micrograms. I apologize. The Mrna is 100. The Pfizer dose is 30 micrograms, and the dose for 5 to 11-year-olds is much less. It's 10 micrograms. And the studies were able to demonstrate that lower dose produced significant immunity in that age group of children. What we don't know yet is the booster, whether a booster will be needed in that age group, and what the dose of booster will be.
So it is a 2-dose, and
Yes.
How far apart? Same for as the adult?
Same amount. The Pfizer dose is it's 1 dose followed by a 2nd dose 3 weeks later.
Okay. So how long does the mRNA vaccine stay in the body there's a lot of concern that how long this is going to be in my body forever. Is it true that it actually dissipates out of the body rather quickly?
It is. Dr. Arona may know the number of days. It's days or a couple of weeks that it lasts. The messenger RNA goes into the muscle cell, and all cells in our body, with few exceptions, have a lifespan, and they go through a destruction process. Mm-hmm. So it has to last enough to stimulate the development of the antibodies to the spike protein, but those cells are ultimately destroyed, and that messenger RNA that we inject in the vaccine it eventually leaves our body.
Okay, great. And then if you could talk a little bit about what are the important mitigation strategies that we need to continue to be focused on, as we all, we are still at just 54% of vaccination in our community. We've got to continue to fight this and not become, have a lot of apathy. So can you talk to us and just reinforce what we need to be doing right now?
Yes. So one of the things we learned through this pandemic, so in 2020, there was, I'm going to show you with my hands how much influenza we had at Children's Healthcare of Atlanta during influenza season in 2020. Zero. It was zero. So we know, and this is probably so awesome for Dr. Arona and her colleagues to have seen this play out as public health experts. The strategies that we use to mitigate COVID, and hand washing is one of the biggest things that we can continue to do. Wash our hands and also use the hand sanitizer that contains 60% or more alcohol in it. That is still so critical. I will tell you, I keep a little tube of hand sanitizer in my car. When I go get gasoline, I use the pump, and I get in my car and I reach down and I use hand sanitizer. It takes less than 5 seconds to do so. So hand washing is very critical. Wearing masks indoors when transmission in a locale is high is still important. Outdoors, if you're vaccinated, not as significant, but even indoors, if there's high transmission, the CDC still recommends mask wearing. And there will be times throughout this pandemic where our masks will come off, and then we'll need to act and adjust and put them on again. And then finally, keeping a distance. We have always said 6 feet. That's still ideal. We now know through some school studies that even 3 feet of distance is still decent to protect us against the spread of COVID. And then don't forget, get the vaccine. That's still really one of the most powerful ways that we can mitigate the spread of this disease. Dr. Arona, anything to add to that?
No, not at all. And you're absolutely right. We saw that last year with the low flu season that we had. And, even though some of our mitigation measures have absolutely relaxed a lot, we still have a low flu season this year, thankfully. So we're really pushing the flu vaccine, which, I think everyone's really understanding the need for that. And thank goodness that we can co-administer the vaccines now. So it's really important for everybody to keep moving in that direction. And as you've said time and time again, the vaccine is the best tool in our tool belt, really, that we have to stop the spread of this bad virus. Thank you so much.
Thank you so much, Dr. Salinas. I know you have a busy schedule today. You are welcome to stay with us, or you can move about and continue to help us save lives. But we just appreciate all you are doing each and every day to help us fight this pandemic, and Children's Healthcare of Atlanta. You've been tremendous partners, and what you're doing in our community is just invaluable. So thank you so much for joining us today.
Thank you, Paige. I am going to sign off. I would like to thank you very much, Dr. Arona. I would like to give you my email address. So if any of you have any feedback into what we can do better, things that you've heard, ways that we can message, I especially worry about vulnerable populations who may not have access to get they don't have the logistics figured out to be able to sign up with a computer, get driven to a place to get a vaccine, have someone with them to hold their hands. Those are the people that we need to continue to reach out to, and we need to get to them through some grassroots efforts. So anything you can think of, please let me know. It's Dan, D-A-N, .Salinas, like Salinas, California, S-A-L-I-N-A-S @choa.org. And I'm happy to help you get your feedback and help us continue to get better at Children's. Thank you again for having me. I really appreciate it. Thank you.
Thank you so much.
Take care. Bye-bye.
Well, bye-bye. And so to that point, I have an opportunity to be out and about in the community. My name is Paige Havens, and I am a marketing community relations consultant who works with the coalition as on behalf of the Gwinnett Cares effort. And one of the wonderful things that I get to do is go out and meet with people in the community and hear their testimonies and hear what their COVID experiences are. So these are powerful stories. And so I had two I wanted to share with you this morning. First of all, what's really amazing is our children are really becoming big vaccine champions. And what I'm seeing is those families are really, the kids are just like, I can't wait to get mine. I literally met a young man recently who celebrated his 12th birthday. The family threw a party around his vaccination. And so I want to tell you that we should not underestimate the voices of our children, and understanding that what we are doing as adults is modeling for the next generation, and how important that is for us to be able to teach our children the importance of their health and their choice and their ability to be able to advocate for themselves as they move forward. And I think this pandemic has really left an impression on that front with this generation that we're working with now. So to that point, I called a father who I knew their family was just such a big vaccine champions. And I said, would you share your family's testimony? And he said, you know what? I think I'd rather have my kids tell you. And so he captured a video of his son, who is, as a matter of fact, at school today, telling everyone and advocating, this is not a bad thing, go get it done. But I wanted to share a video with you that he sent over to me last night. And it's just a sweet, genuine message that Kava brings to us today. So I'm going to play this for you now. Can you see that?
All right. Good morning, everybody. This is the voice of Babak Mostagimi, and I am doing a quick interview with my son about his experience with the COVID-19 vaccination. So let's start with the easy questions. What is your name?
Kava.
Kava, and how old are you, Kava?
9.
You're 9 years old. What grade are you in?
4th.
4th grade? Okay. Why are you so serious?
What do you mean, why am I so serious?
I'm just kidding. Okay. All right. So have you gotten your COVID vaccination?
Yep.
And what was that like? What was it like to get your COVID shot?
It was awesome, and it hurt a tiny bit.
It hurt a tiny bit. Where did they give you the shot? On your arm? Okay. So why did you get your COVID shot?
Because it helps my community.
Okay. And how does it do that?
Because it protects the people around me from getting COVID.
Oh, interesting. Okay. So you really wanted to do it because it helps other people?
Mm-hmm.
Oh, that's nice. Okay. What would you say to people who are about your age, who are kind of worried or scared about getting the shot?
I would tell them that you should just get it to protect your friends and family.
Okay. Is there anything you would want to tell parents about getting their kids vaccinated?
Is to just get their kids vaccinated.
Just to do it?
It's so awesome.
Okay. All right. Well, you heard it from Kava Mostagimi. He has done his part to help us get out of this pandemic. Thank you all so much. And I hope you get the opportunity to do your part as well.
I just don't think that can ever underestimate the power of the voice of a child. So I think that it's really the message that their family wanted to send is be champions. Teach your children to be a voice and encourage others, because as we all know, children are very afraid of shots. And this is an opportunity for them. But I love that in that family, they've created a message of it's not just about you. He didn't say, I'm protected. He said, I'm doing my part to protect others. And it's just, it was such a sweet message I really wanted to share this morning. Now, a lot of people really are on the fence. Those that are on the fence say, I'm not sure it's time yet. And I want to stress that we are coming up. We are 1 month and 1 day away from 1 year anniversary of the vaccine being released into our world. And there were some amazing, brave people in this world who stood up and said, I will do the trial. I will let you test this on me because people are dying and I'm willing to do it. And we are blessed to have someone in our community who raised his hand and did that. And he is just an unsung hero in our community. And so I want to turn it over to Julio Carrillo and let him tell his story about how he went through the trials and how he has faith in this vaccine.
Well, good morning. Good morning, Peggy, and good morning to everybody who joined us this morning. And thank you to the Gwinnett Coalition for everything that you do. So yes, I signed up to the trials. I'm part of the Mrna vaccine study. I'm currently still on the Mrna study. I received not only the 2 doses, but also the booster doses as part of my experience. I decided to step in and do something about it because, to be honest, I have never done anything like this in life. I'm always afraid of needles. I'm kind of embarrassed that this little kid, it was just like, here, they put it over here. And I was just like, fear of the whole process. But I was overwhelmed by what it was happening in our community, in our world, seeing how people were impacted directly and indirectly, how many people were dying, how many people indirectly, they start losing their jobs. They didn't have no way to make an income. Education got interrupted. I start having some hard conversations with my own family, my mother, which we were separated during the process, and I start looking at the scenarios. What if I get this virus or you get this virus and we're separated and I can't be in the hospital with you? And then through work, I'm part of Families First, a nonprofit organization that serves over 16,000 families in the annual basis. We have a wonderful program in Gwinnett. And start seeing and hearing what the staff was going through, hearing my staff sharing really sad stories about our community and how our clients were being affected. And I started researching about how are we doing with this vaccine, what is happening. And through my research, I came across through the Hub Clinic, Emory Hub Clinic, and I learned that they were needing volunteers. And so I inquired online, and to my surprise, in 48 hours, I received an email that they wanted to speak with me to do some sort of pre-screening. So I was nervous about it. I didn't know what to expect. So we got in a call. They walked me through the process. They did a pre-screening. And I started inquiring and asking questions. Never felt that I was forced or they were trying to sell me anything with the vaccine. I decided that I wanted to take a moment to conduct more due diligence and learn more. And so I talked to my doctor. I did some research, came out with a series of questions related to the vaccine, the process, the side effects, what will happen, what will not happen. And based on those answers, I felt very comfortable. I attended to my first appointment that it lasted close to 3 hours. They did blood work. A doctor saw me. We talked about it. They asked me how I was feeling. They make me feel very comfortable. We went over paperwork, and it was the moment of truth, So they brought into this room a shot that I didn't know what it was, because part of the vaccine is you do a control group, and so some group will receive it, some other don't. You will know. So I got the shot. I know my body. It was interesting because they kept me there and everything was fine. I was providing resources, so they explained to me that I was going to be monitored by them, that I have a phone number that it was available 24/7. If I was experiencing any symptoms, I had to log in into an app to record what it was happening. So they kept me there for a good 45 minutes just to make sure that I was fine. They were super nice, super friendly, from offering me something to eat to water. Wonderful people. Came home. I felt soreness a few hours later, and I started feeling a little bit tired. So I knew that probably I didn't want to think through, because psychologically you can also start creating those side effects on your head. So I just went on with my day, and then I continued to get the monitor, and then I was called 20 something days later for my next appointment to get the second doses, and got blood work and all of that, and got the second one, same process. They kept me, came home, have some light flu symptoms during a period of 24 hours. Probably I knew at that point that I had to receive the vaccine. That was just my assumption. Again, they don't know. And so yeah, so I took the doses, and again continued to getting the safety calls and drawing blood, and everything is going perfect. And then I was signed up for the booster, took the booster, no side effects. They disclose after the second doses several months later. I signed up to disclose what I have received, and I learned that I got the vaccine. And I've been just using this experience because I also wanted to make sure, one of the things that I learned during the process is that they needed minorities, they needed Latino, they needed data, we needed to be represented, we needed to make sure that the vaccine was working equally in all ethnicities and backgrounds. And so it's been a wonderful experience. I was able to convince my own family, who had fears about getting the vaccine, as a result of my own experience. And I have been using my own experience to become an ambassador to educate people that I trust science. When we are sick, we go to the doctors and we don't question it, what they're doing it, what medication they're giving us for our headache. And I decided to take the same approach and say, this is not the time that I'm going to question science. I do trust the people who have devoted their lives to do this work. We're in the best country in the world when it comes to research and evaluation. We have an amazing doctors and community here. And I say to myself, if I sit here and I don't do anything about it, this virus can maybe come after me and something will happen. So I'm going to be part of the solution and not the problem. And so that's my experience.
That is powerful. You know, you talk about trust. And so at this point, I just have one question for you. Going through the process, and I'm sure you probably dove deeper than any of us in the process itself. Do you trust this approval process that they go through in this vaccine, and how the testing, and you have confidence in the systems in place to produce something that is as safe as possible?
200%. I will do it again. Because I did my research and because I had a lot of time to spend time with the doctors, and I'm very curious, so I'm not shy to ask questions. I asked too many questions. And even after I came home, I would just email them with additional questions. I mean, they did not skip anything in the steps. There was nothing that they just like pass through, you know. I mean, matter of fact, this is very rigorous. I mean, research and evaluation studies has a very extensive protocol, and these people are by the book, you know, and they respect all the rules. What I also learned through my research is that the technology that it was used for this vaccine was not made overnight. This is something that it's been around since late 1987. And so, and I do think that when I step back and I look, a lot of the misinformation and the fears, and part of what I wanted to do this and use this as a platform to educate people is that this is something that did not happen overnight in terms of the technology that it was used. It's just that it's been evolved. And I think we need to get used to the technology has expedited and accelerated so many things from this point on. And actually this this process probably are going to accelerate a lot of cures or so many things down on the road. And so we just have to trust the experts. And again, I 200% never question anything, have not questioned anything that I have seen up there. I just think that it's just a lot of misinformation. And I just love that there is an opportunity to bring experts here, the doctors who devoted their life to do this wonderful work. These are the true heroes here. You know, it's just the people who are behind the scenes working day and out. And we owe that to them. We owe them to the doctors and the nurses that put their lives at the front of their lives. I mean, I have friends in the medical field that they were not able to go home during the pandemic because they were afraid. There was people that we lost, that we know that we lost during the process, that they wish they would have had the opportunity to have the vaccine. So I'm encouraging everybody, trust science. If you do it for everything else with your doctor, there's no reason why you need to be making exclusions here. That's a very dangerous space.
Good words to end on. Thank you so much, Julio, for being with us today and sharing your story and giving us more confidence in this effort as we move forward together. So we appreciate you being here with us. And with that, I would like to turn it over to Dr. Arona to introduce our next speaker.
Thank you. And Julio, what a tremendous testimony. Thank you so much again. I mean, hats off to you and thank you for your courage, what true courage it took. You know, you have truly saved, you know, millions of lives, no doubt. And to those who are still fearful about the vaccine and the science behind that, I mean, just imagine what Julio did at the very beginning. So, you know, what a true hero, and may God bless you for that, Julio. But I'm so honored now to get to introduce a friend of mine and a colleague, Dr. Sherry Drenzik, who she grew up in Detroit, Michigan, and received her bachelor degree in biology and a master's degree in food microbiology from Wayne State University in Detroit. She attended Michigan State University College of Veterinary Medicine and received her license for veterinary medicine in 1995. In that same year, she also entered the Epidemic Intelligence Service program at the CDC and was stationed in the rabies section. So following that, Sherry was employed as an assistant professor of epidemiology at the University of Georgia College of Veterinary Medicine. And she's been employed at the Georgia Department of Public Health since 1999 and served a variety of roles there, including infectious disease medical epidemiologist and state public health veterinarian. She served as director of the acute disease epidemiology section and deputy state epidemiologist from 2005 to 2011, and was finally, as she should have been for a long time, named state epidemiologist on August 1st of 2011. But in addition to that, she has been named as our Department of Public Health's first Chief Science Officer in 2019, just in time to lead our epidemiology response to the COVID-19 pandemic in Georgia since January, of course, 2020. So welcome, my friend and colleague, and we're so grateful that you could be with us today.
Thank you so much, Dr. Arona, and thank you all for inviting me this morning. It's such a great pleasure to be with you. And it's really an honor to see your work in action, meaning what you do make a difference every day, and as evidenced by those very powerful testimonies as well. So thank you again. So for my part this morning, what I'd like to do, I have a few slides to show. Much of what I'm going to talk about is similar to what we've heard before, but what I wanted to do is kind of give us kind of a big picture view of the epidemiology patterns of our COVID epidemic in Georgia right now, and essentially to sort of lay the groundwork about how we use data and how we use epidemiology to, again, target the very work that you do, how it makes a difference in how we actually make our mitigation strategies most effective, and go from there as to what our next steps will be to end this pandemic, which, as my colleagues have said, and you feel every moment of every day, we can't wait for that to happen, that none of us really expected that we would still be doing this close to 2 years, 2 years out. So I'm hoping that, again, some of this information will provide to us some very good news. I think we're in a very good place now, but I also want us to be cautiously optimistic. I want us to, again, not be complacent about the future and not feel that, again, we don't still have a tremendous role to play to encourage those mitigation strategies that we've all just heard about from Dr. Arona and Dr. Salinas and from our colleagues on the call as well. Again, we can't let up now. We absolutely can't let up now. So let me take the opportunity, if it's okay with you all, to share my screen and go through a few slides that I hope will kind of give us a big picture of what we've been through and hopefully where we're going in the future. So I'm going to move to here and let's see, share my screen, slideshow, beginning, and oops, I apologize. Let me go back to this. Let's do the share screen part first. Sorry. All right. And okay, are we good? Thank you. Thanks so much. You got to remember to hit the share screen button first before you can do anything else. So, all right. So what I'd like to do is really start with a snapshot. This is kind of a big picture view of what's going on with COVID in Georgia. So ultimately, Dr. Arona covered kind of our cumulative numbers. Certainly, we've had, more than, almost 1.7 million cases of COVID in Georgia so far. But ultimately, where we are and where, we are facing the future is that over the last 4 months, we experienced what we call the Delta wave. It began in the beginning of July, and this was the spread of the Delta variant that was new at that time, that was much more transmissible than the previous, sort of Alpha variant that we have been dealing with, and the original COVID variant as well. So the Delta wave started in July. It took about 2 months to peak, which was right in the very beginning of September. And it took about 2 months to kind of decline as well. So that's where we are right now. We're 4 months in, we're, kind of beginning of November. So this is very typical of Delta waves all around the country and all other parts of the world as well. What we've been seeing with this particular SARS-CoV-2 virus around the world is that it kind of goes in these 2-month cycles. So here we are, and we have subsided here in Georgia to kind of a low plateau, but it's a relatively low plateau. Where we are day to day over the last 2 weeks in Georgia is ballpark about 1,000 to 1,300 cases of COVID statewide every single day. So again, this is much 90% lower than it was in the beginning of September at 12,000 cases. However, still 1,200 cases a day. We're still talking about some transmission going on here. And the fact that it's plateaued now, and I'm going to show you this in a second, causes me to have some concern and causes us to think about the fact that we need to be cautious. We are not, again, decelerating to this, absolutely bottomed out level where we have very, very, very few cases. We still have transmission going on. And as you all know, we still have half the population of Georgia that is not fully vaccinated. So there's plenty of opportunities for transmission to still occur, and again, to even take off again. So I think of that plateau as sort of a jumping off point. So it's something we should watch and be cautious of. This is what's going on nationally as well. And as a matter of fact, over the last few days nationally, this plateau has just creeped up a tiny, tiny bit. So we just should be very cautious and not let up on our usual mitigation strategies. The good news, altogether good news, the good news also is during this Delta wave, we saw tremendous impact on children, as Dr. Salinas had mentioned. We saw, again, very high peaks in kids that were affected during our Delta wave. And now we're seeing consistent declines across the board, which is great news. We're seeing declines in every single indicator for the impact of this virus, this Delta variant on kids, which is great. Outbreaks in schools have declined, hospitalizations among our pediatric population, deaths, and cases as well. So this is great news. We don't want that to change as well. And if you look at the state as a whole, we really have gone from having every single county in Georgia have those high transmission levels down to less than 10% of our counties in Georgia now have what we call that high transmission level that Dr. Arona mentioned earlier today. So this is great news. And again, this has happened in that 2-month period of time. And in that, and as I mentioned already, the context of where this decline is happening is still amongst a population that is about half not fully vaccinated. So I think, again, it really just, again, hammers that point home. You've heard us all say it throughout the morning, and you experience it every day. It's absolutely no time for complacency. So the other thing that I really just wanted to mention, and I'll show you just a little bit, one thing that we don't want to decline and that we're actually seeing as well. Everything else is declining. This is a good thing, but we're also seeing some relatively small declines in our number of vaccine doses that are being given, especially in the last month. If we kind of compare statewide in Georgia, the first week of November to the first week of October, a month's period of time, we declined about 30% in the number of vaccines that were given statewide. It didn't happen across the board in all areas, but it was very consistent among children, the children that were eligible at the time, the 12 to 17-year-olds, certainly. So we want to be sure that, again, by knowing that, we say, well, okay, this is an area that we have to continue, as Dr. Salinas mentioned, as our ambassador 9-year-old said this morning as well. This is an area that, and especially for the younger ones now, that we need to continue to try to reach to protect not only themselves, but their families and their communities too. So one of the things that I wanted to just sort of leave this slide with is, in areas of the United States that are beginning to see colder weather, such as some of the Mountain West, we're seeing surges again. And as a matter of fact, some large increases, Colorado, Montana, Wyoming, Alaska had been very, very high, a big hotspot, but they're coming down just a little bit now. Again, Europe, which has traditionally served as a signal for us in the US, is now, again, it's colder there, but also is experiencing some case increases beyond that they had seen in the whole pandemic, as like Germany. Germany's case numbers over the last few days are the highest they have ever been. So this is not where we want to go. And we hope we don't get there as well. So again, if nothing else, and I know you can appreciate this, this virus does nothing but surprise us, right? So we have to be on our guard. So let me go to our next, oops, sorry about that. Let me take a moment and move this over here. Let me take a moment and show you in some pictures kind of what I just described. Let's just take a real brief look at the surveillance indicators that we talked about. Primarily, we're going to look at COVID cases, we're going to look at COVID deaths, and we're going to look at COVID hospitalizations in Georgia and just show you this Delta wave. It's really interesting. So again, here we are. If you take a look at this graph, you've seen this before, as Dr. Salinas showed you, we've got the 4 waves of a pandemic. 1, 2, 3, 4. Here we are. This was January, last January. This was huge, prior to widespread vaccination. But look at what Delta did, so again, very low levels in, sort of June here, July, we started coming up. Here's our peak, which is late August, early September, huge peaks in cases. Again, 12,000 cases here. But look here, if you just kind of take a little peek at the last week and a half or so, it's not a sharp decline. It's starting to plateau out. If you look at the national epi curve, it looks flatter than this. But we're getting there. I think we're right in that same boat where we want to just be careful. So if you look at just the, if you look at the level where this plateau is, see where we are? We're actually higher than we were kind of in early summer and spring, or higher here. So we're not, it's not an insignificant amount of transmission. It's great. 90% decline from here, but still just keep in mind, we can move pretty easily off this if the transmission levels, if the transmission begins among susceptible populations. So one thing I always like to show, people are always curious, like if you look at those waves that we just showed in total cases, what were the age groups that were, affected during that time? I think it's completely fascinating. Across the board, from the very beginning of the pandemic, from the first wave through, even through the Delta wave, the age group that was most frequently affected by COVID infections were basically kind of, young to middle-aged adults. So our adults, this blue line right here, consistently, are adults 35 to 54, all along, all right from the beginning. And the line below it are just adults that are just a bit younger than that. The next group down, kind of 20 to 22 to 35. So that's been really consistent. But look at what happened during Delta. Like kids, let's just take this kind of olive green, which is school age kids. You might not be able to see this, but this olive green line, very, very, very low, very low. Check this out during Delta. Here's school kids. Oh, rose way up to, essentially, second place in the age group categories. That's phenomenal. And Dr. Salinas showed you that as well. So this school age, surge was, beyond what we ever expected as well. So, and luckily has gone down. Oops, I just wanted to go back for a second. And luckily we've come from that peak down to really our usual pattern as well. So we're still seeing cases now, primarily in this, sort of young adult, and our school age, all of our school age kids are down quite low as well. We're seeing tremendous improvement there. So again, it's fascinating. And the reason that again, looking at a data like this in a detailed way, where you're actually seeing which age groups are most affected, allows us to try to target prevention measures there, which we did, during the school age population. So now that was our first indicator, cases. Let's hope that these declines continue. Let's look at deaths as well. When you look at COVID deaths, they are called what are referred to as a lagging indicator. And what that means is really that as cases go up or down, deaths follow by a couple of weeks. They're not united, kind of in time. It takes a few weeks, certainly for an infected individual to, sort of go through their clinical course, develop, sort of complications in their clinical course, potentially get hospitalized and die. It takes some time. So deaths always are sort of behind cases by a few weeks. So what we're seeing now in deaths, finally, during our Delta wave, which is here's our Delta wave. These pictures will all look the same to you with these 4 waves. We're finally seeing a drop in deaths over the last week and a half, 2 weeks or so. we were pretty stable. While those cases were coming down, our death numbers were still tremendously high, in the 100s statewide, which again, as far as I'm concerned, again, are especially in the advent here of this period of time are totally, for the most part, preventable due to vaccination. So tragically still had these really high deaths during this wave, but now are starting to decline as well, which is good. And we hope that continues. And if we look at in the same way, now, if we look at the age groups that are most affected by COVID deaths, we're going to see a really consistent pattern as well. Across our 4 waves here, we've got individuals that are older than 65 consistently comprise the highest number of deaths in every single wave. So even now, even though luckily, we had that school age child, a spike in cases, we did have an increase in deaths, but by far, again, we're still seeing most deaths occurring among individuals that are over 65, this pink line. But here's another thing that I think is really interesting that I hope also is a strong, sort of plug for vaccination as well. This is a highly vaccinated age group, those are over the age of 65. So even though they still comprise the highest number of deaths during our most recent wave, very often they have comorbidities, and this is not a surprise. But look at the volume or the magnitude of deaths in the January peak. Here they are again, more than double the number of deaths among age 65 and older versus Delta. So again, this is because they weren't vaccinated here and they were vaccinated here. So certainly, obviously, every COVID death is tragic, potentially preventable, but still it really, again, I think underscores for us how well in a highly vaccinated age group, how well the vaccine works for severe outcomes and deaths. At least it kind of reduced this magnitude dramatically. And and we were very lucky to have the vaccine available, during this year as well. And we got to kind of continue that moving forward. All right, so we went through cases, deaths. Now let's look at hospitalizations. Same picture, right? Looks the same mostly. This is a graph that basically just shows the number of patients that are in the hospital every single day with COVID. So it's a census, a daily census of COVID. And I think it shows the picture kind of in a little more real-time way than from the ones that are reported to us. So again, we still had this really high Delta peak in the very beginning of September. The peak day for hospitalizations in Georgia across the state was September 7th. And we had 6,000 people in the hospital with COVID in Georgia on September 7th, which was much higher than it was even during January. And it came down here now, as of yesterday and the day before, we were about 1,000, about 84% decrease from our peak in early September, which is great. But again, still 1,000 people hospitalized every day with COVID now. And again, as I had mentioned with our deaths, also thinking about hospitalizations, nearly everyone that was hospitalized and died of COVID, in this Delta wave was unvaccinated. We do have some breakthrough cases. We do have some individuals, but a very, very small proportion, which I'll show you in a minute, but still. So these folks here that have experienced these really high hospitalization rates during the Delta wave were by far unvaccinated individuals. So let's see what their age group was. Let's see if this is similar. Indeed, I think we're consistent pattern as well. So again, among the deaths, mostly age 65 and older. Among the hospitalizations, also 65 and older. That pink line again, look at that huge pink line for hospitalizations during our January wave. And again, it's also during this Delta wave. However, look at the very kind of, middle of August to begin, end of August right here, this blue line. Here's those middle-aged adults, 35 to 54. So this is the only time, was during the Delta wave, that these folks, again, had high numbers of hospitalizations and even overtook the 65 and plus age group. That was pretty significant for our Delta wave. And that happened in other states and nationally as well. It was kind of a skewed younger. Why? Because these people were less vaccinated. So the age 65 and older is a highly vaccinated age group. This is less so. Let me show you how that plays out. So these are our vaccination rates by age group across the state over time. Wouldn't you love these lines to look like those waves, like really high and not coming down, but they don't look like that, unfortunately. They're just kind of going up, but kind of trickling along, as we can say. But look at this. I should have made these colors the same. I'm sorry. Our pink folks, the age 65 and older, now about 90% vaccinated. And here we go. So this is, again, highly significant. And even though they still comprise the higher, the most common people that get hospitalized and die, likely because of their comorbidities, it's still way, way, way less than it was in January. By far, less than half. That's how many people, again, lives were saved potentially from vaccination or from severe outcomes. But here's our, this yellow line, here's our middle-aged adults, the 35 to 54, about 64% vaccinated. So still a high number of susceptibles there. And that's why we saw those hospitalizations rise during our most recent wave. I guess none of this should be anything, surprising in a sense, like anything new under the sun. The more highly vaccinated a population is, the more highly vaccinated our communities are. Certainly we can protect our communities at every age group from severe outcomes like hospitalizations and deaths by vaccination. It's a huge, it kind of shows you it's a huge impact on that. Here's our school kids right here, 49, 47, or college age, high school and middle school kids. So really, look, we've got a lot of room for opportunity to improve our vaccination coverage in kids. And I think that that certainly, these are the 5 to 11-year-olds. So hopefully we'll start getting that line rising soon as well. So let's see, I'm pretty close. So we mentioned breakthrough. I wanted to say that, again, we know that vaccines work excellent against severe outcomes like hospitalizations and deaths, but no vaccine is 100% effective, none. These are highly effective and highly immunogenic vaccines, but we are still going to have some individuals that get infected after being fully vaccinated. But look at these proportions and these numbers. So far in Georgia, here we have 5.3 million people that are fully vaccinated. We have documented 70,000 people that have had COVID infection. That's this red little slice here. And we have documented 973 people that have died after being fully vaccinated. We don't want to see this, obviously, every death is tragic. However, the proportion is so small versus the 5.3 million, 5.8 million. Again, it's like a 1%. And again, it really, again, highlights for us the importance of continuing to promote vaccination. I have a link here that I hope we can share these slides with you all that you can take a look at. We have a much more detailed breakthrough report that really shows a lot more information than we have time to kind of look at now. But I wanted to just highlight how well we really are seeing these vaccines work against severe outcomes and against infection as well. So in summary, just to kind of wrap everything up for you all, again, as I said, our Delta wave in Georgia and in every other place took 2 months to peak and 2 months to decline, but we have a relatively low plateau that we should still be cautious about. We're still seeing declines in hospitalizations and deaths because they are lagging, but we expect them to plateau as well. the good news is that we're seeing tremendous improvements in the impact of our Delta wave on children. They're doing much, much better. And we love to see that. And we hope that that continues as we start to vaccinate more younger children as well. I want to, again, just underscore and highlight, please, no complacency here yet. We've seen increases in other places, particularly in colder weather areas. We hope that that doesn't happen here. So many other coronaviruses, although it's not really extremely well characterized about SARS-CoV-2. Is it seasonal or not?
Dr. Drenzik, your screen froze, so I'm not sure if you're still with us or not. Well, that's unfortunate.
I know it. That was such an amazing
Yeah,
presentation.
let's
Maybe she'll come back, but maybe Dr. Arona, we could
okay, well,
move to you.
maybe Sherry will come back on, but I
Right.
just wanted to say a huge thank you. There she is. Dr. Drenzik's back here now. We just lost you at the very end.
So sorry. I lost internet.
That's okay. Please finish though. You were.
Oh, I'm just at the very, very end. My apologies about that. There we go. So I'll just.
We were hanging on with bated breath.
I know. And,
The end of the
guess what
story.
the ending is going to be? You actually know the ending and you can predict it. The ending is, again, consistent with what everyone else said as well. Again, if we want to continue these declines and we want to stop this pandemic, we have to continue our mitigation strategies that we know work. Promote vaccination, masks when appropriate, staying home when sick, washing hands, everything that we know work, we cannot let up. And those are all critical. And I think that hopefully this information has shown you the importance of continuing, particularly these vaccination strategies. But we can't forget those adjunct measures. They have to be done together. Vaccines work, beautifully, as we have seen throughout the morning. But we cannot, just completely let go of those other mitigation prevention strategies as well. And that's it. I'm just going to stop right there. The only thing I'm going to show you while we're kind of preparing, if you have questions for me, is I just wanted to show you a quick little map of the U.S. talking about these increases. Look at this. In August, at the peak of Delta, or beginning of the peak of Delta, again, look at all this red, red is bad, so certainly we've really flipped. In the Southeast, this is where we experienced Delta peak. Look at us now.
Dr. Dresden?
Again, everything is back into Mountain West and cold areas.
We can't.
So
see
again, it can happen. Let's not give up, right? All right.
We can't see your slide. If you could show that to us, I think that'd be good.
We want to see.
All right. Really? Oh, you know why you can't see my slide? Because I'm not sharing my screen. How does that sound again? So sorry. When you lose your internet, it just makes you. All right, here it's slide.
Oh, that's great.
All right. All right, can you see it now? Okay.
Yes.
So look at this. So this is a national map. And again, without, the details of all the numbers, the darker, the worse. So look at us in Delta during August, us and Southeast. And look how it's all flipped. It's like the exact mirror image, really. See this cold weather area here, Wyoming, Colorado, Arizona. These are where all of the, sort of large increases are happening now. But they're starting to peak a little bit over here, too, in the Northeast. So let's not be complacent.
Wow. Well, thank you so much, Dr. Drenzik. We'll
All right, so here I am, and I'm, back on, and sorry about the, I don't know what happened. It's just like the internet just went right out. So
No,
I'm happy to answer questions if we have time, or if anyone wants to send me any. I'm happy to share my slides with everyone here. My contact information is there. I'm happy to answer any questions in the future if you think of it. And again, thank you all for all that you do.
Well, thank you, Sherry. And the only question that I see really for you is do you think that wave that moved to the kind of the Northeast is going to wave back our way again with the cold weather?
It could, it really could. I just don't know. So our previous experience, again, like I said, this virus does nothing but surprise us. Maybe we're going to end up seeing that this type of that the SARS-CoV-2 is a seasonal virus like flu. Like maybe it is a cold weather virus that shows up, kind of mostly in, kind of this after holiday thing, so we've got holidays coming up too. And then we have colder weather coming as well. It certainly could, but we know how to stop it as much as we can, right? We still, even if that's the case, even if we do have a crystal ball saying, I know it's coming, guess what we can do? Get vaccinated, wear masks, wash our hands.
Wash our hands, absolutely. Well, thank you so much, Dr. Drenzik. You have, we're so grateful for you and all of your work, which has just been a tremendous amount of work, even before the pandemic, but since the pandemic is incredible. You've been a staple for the state, and you literally are the best resource for the entire state, and also specifically to the health directors like myself across the state. So we're really particularly pleased. And as you were telling your story and painting this picture for us today, this is so important, because what we share with future generations 20, 30, 40 years from now is going to be what you just presented to us. And I really do believe that the legacy that we leave and what we stand for in our lifetime really matters. And I can hear great grandchildren saying, were my grandparents vaccinated? Did they do, what did they do during this time? So I think it's really important that you paint that picture. And thank you so very much.
Very welcome. Thank you all for having me.
And if you can hang on for questions,
Sure.
If there are any, that's great. If you can't, I understand.
Oh no, I'm right here. I'm with you all the way.
Pretty much leading into exactly kind of finishing what she was saying. Can you all see my screen? It should be blank. Can you see that, Renee? Thumbs up. Okay, good. Oops, hold on a minute. Let me pull something different here. You're not the only one that has issues there. Let me do. And then I'm going to get down to the page here real quick. So, all right. So the important thing here is that, just like Dr. Drenzik was saying, this COVID is not over yet. And we still need more people to get the vaccine, of course. And meanwhile, while we're trying to get people vaccinated, we have to continue these other things to prevent the spread, just like Dr. Drenzik was saying. So I like to kind of look at this pandemic right now at this very time, kind of like an intersection. Okay. So if you're at a red light, we teach our kids how to drive. So if you're at a red light, you're supposed to stop. So if you have COVID, you isolate, you stop, you isolate, you stay away from others. If you get a yellow light, you proceed with caution. So that is kind of similar to being exposed to COVID. Okay, so if you're exposed to COVID, similar to a yellow light, you're regardless if you're vaccinated or not, you're going to, be extra special careful. For those unvaccinated, they have to quarantine. For those people who are vaccinated, you get a test on day 5 to 6 to make sure. You don't have to quarantine, but you just kind of make sure, and you kind of follow that. But even if you have a green light, meaning you're vaccinated and you're doing okay, we teach our kids in an intersection, even in a green light, you gotta be cautious, because the people around you may not be following those rules like they should be. So you proceed as normal, but at every single intersection, you look and be careful. And that's similar to COVID right now, because if you're vaccinated, that's great, but we still got to be cautious when we're around others. So as we approach the holidays, some good takeaways for the holiday is, look, this is great. We get to gather, we get to travel, if everyone you're with is vaccinated, you're really good. You're really good. But if anyone you are with is not vaccinated, the risk level increases. So again, if the amount of people that you're with, the more people unvaccinated that you have around here, the risk gauge on the right-hand side goes up. And again, goes up again, the more people that you have. Remember though, that if you have people that are unvaccinated, it doesn't mean you have to stay away from them or they're not invited. They can, even if they're unvaccinated, of course, and vaccinated and having symptoms or whatever, but they can all get tested before your get together. And testing is available even on Christmas Eve. You can go to the Santa Fe Mall on Christmas Eve. And if you're there before 11, you'll get the results the same day. It's a PCR test. It's not a rapid test. So it's very important. But these are really important things to remember. And the most important thing to remember is that whatever happens this year, if you're sick, you stay home for the holidays. And even if that happens, we certainly are going to have a better holiday than we had last year because, the vaccine has been with us for a year now. So I also wanted to plug, like we've been talking about, the flu vaccine. Don't forget to get your flu vaccine with your COVID vaccine if you have not gotten it already. And again, the whole idea, let's share presents, not the flu. So everybody get vaccinated, and that is it. I'll stop sharing and see if anyone has any questions and turn it over to Paige and Renee.
Any questions from the audience today? We have covered a lot of information. Just put it in the chat real quick. It looks like Elena has done a fabulous job of answering questions as we've gone along. I think it's a really great opportunity for us to just be reminded of the important facts and equipping ourselves with the information we need to continue to be safe. Just before I send it over to Renee for closeout, I would like to just leave us all with one thought, and that is, it is so important for those of us who have been vaccinated to be compassionate to those who have yet to be vaccinated, and to be empathetic with where they are, what their hesitancies are, and how their feelings matter too. And everybody has to walk this journey in their own time and in their own way. And so as we move into the holidays, it is so important that those of us who have gotten to a yes in our vaccination journey can listen and share with others, and just share your heart as we sit with family and friends so that we can continue to move more people forward. And there's a beautiful new quick video I would like to share with you that I think will tell the story. Can you see?
Scene 103, take one. Here we go. Is our camera up there? My name is David, and I'm here with my sister Esther.
First name, right? Just not.
Sorry. Wesley, with my knucklehead brother.
Oh, okay.
My friend Duffy.
My boyfriend, Doug.
I have been 100% into getting vaccinated, and then I asked you, and you hesitated.
Yeah.
There's not that long-term research out there yet.
How do I know the way I'm going to respond to it? They're saying that the vaccine is 99% effective, right? Where are you going with this? 99 of those people survived. Great. You ask me what? I don't care, Wes. What about the one dude?
I feel like I'm okay without it.
The reasons are frustrating. Like when you say, I'm afraid of needles. You are a grown-ass man. Like, you're not afraid of needles.
No, I am.
I know you are.
I'm just saying, like, everyone has a right to make their own decision.
But why would you want to take that risk?
All these shots after shots, like, I don't want to have to go through all that.
Compare that to having to be in a hospital for a month.
They're
So, like, think
also
about this,
asking
look.
you to do your research, to go see your doctor, ask your doctor questions so that you can protect yourself and protect the strangers that are also.
In a year or two, I would think about taking it. I'm just saying, I don't want to be on the front line. But you're human. You're going to make a mistake.
Ugh.
Can you imagine being the person that goes to somebody's house and gives them the virus that kills them?
what if you're one of those cases, you know, and you end up in the hospital?
Yeah.
That's what I'm scared of.
You're the closest person to me. It makes me worried.
I want you to get the vaccine because I want you to be safe.
Your eyes look really sad right now. I'm tired of taking care of patients and like being just the last person they see before they die. I have to be the one to share those last words with family members.
If you was to die, man, literally kill me, man.
I hug you.
Yeah. It made you feel that way, bro. I'll probably do. Love you too.
Renee, back over to you.
So after we did the last healthcare summit, it felt like that was just an amazing, and it couldn't get any better. And then today, hearing the words of Doctors Arona, Salinas, and Drenzik, once again, we just continue to learn about this COVID-19 and the Delta variant, and how we together, individually and collectively, can make a difference in reaching herd immunity and preventing this deadly and very tragic disease from impacting our friends and family. The video points out those complexities around that individual decision-making process. But the good news is we have some data, we have facts, we have information that we can put our fingers on. And I know what Paige has found is she's been out in the community along with public health officials and really working the process and educating folks. It's the one-on-one conversations that make all the difference. So what you can do is to use the resources that were provided today. We will have the Facebook Live video available on our website. You can connect via Facebook at GwinnettCares.org. Share the video, watch the video, perhaps with your family and friends, and help them understand some of the nuances and the information and the facts around what the vaccine will mean to them. Also visit GwinnettCares.org. It's a website with many resources around, again, the facts, and then also where you can go and get the free vaccine. It's everywhere in our community, so its availability is very large. It's just helping people make the decision to get the vaccine itself. And so thank you to all of our speakers today. I've already called out Drs. Arona, Salinas, and Drenzik, but I also want to thank the Mostagimi family and their precious 9-year-old boy who gave some words of wisdom, and then also to Julio Carrillo, who really stepped forward and led in a very important way early on in the pandemic. And so thank you for your service to the community and to the nation in that regard. And we will just continue to walk hand in hand with our public health officials, Dr. Arona and her team, and the state officials in promoting vaccines throughout this community. We want to be healthy, we want to live, and what we do know as a fact is that we are better together. So let's get rid of these masks. Let's get to a point where we can at least move this from a major disruption in our lives and in our community to what Dr. Salinas referenced as more of a nuisance. So I look forward to continuing that journey with you, and thanks to all the partners on the call today and to all of you for tuning in. Be well and have a great rest of the week.